Hi everyone, I am Dr. Jeanette DeWitt with DeWitt Physical Therapy and Wellness, and I'm a physical therapist, an athletic trainer, and a fitness coach. Today we are going to start our September series on DIY, do it yourself, on how to help control your pain symptoms at home with just household items. Today I'm going to teach you how to create your own ice pack. You're going to learn the benefits of ice, when to use ice, and how to make that ice pack. Now, what are some of the reasons and what happens to your body when you apply ice? One of the things that occurs is that the tissue temperature is obviously going to go down. You're going to reduce that tissue temperature, and this can help decrease inflammation. Applying ice will also reduce the metabolism in the area and helps to reduce pain. It also helps reduce muscle spasm. It can increase tissue stiffness. So if you're having joint stiffness or muscle stiffness, ice actually isn't the best thing to use for that. But if you need to decrease blood flow, decrease inflammation, ice is a great way to help control those. Now, why would we want to apply ice? Here I'm going to get into a little bit more detail about what happens after an injury. There's different phases of an injury. So for an acute injury, which is the first 0 to 4 days of an injury, you're going to have emergency care, which this is when it's an emergency. You're calling 911, CPR might even be issued or applied. That's really not what we're talking about with ice, but we will talk about ice when it comes to immediate care, which is the first 0 to 12 hours after an injury. When you apply ice within the first 5 minutes of an injury, you significantly reduce the tissue damage that can spread in the surrounding tissues. So you have your primary injury, let's just say somebody tears their ACL. You want to apply ice immediately because the swelling that can happen from that ACL tear isn't going to just impact the ACL that is torn, it can also impact the other tissues in the area. Applying ice reduces the damage to the surrounding tissues. So applying ice in the first 5 minutes and then repeating ice every hour to 2 hours significantly cuts down on the surrounding tissue damage besides the exact injured area. Transition care is the next 12 hours or after 12 hours up to 4 days. And again, you want to continue to apply ice during this time. Now, when we move into the subacute care time, this is about 5 to 14 days after that initial injury. And here you can combine ice with exercise because the ice will reduce your pain, continue to reduce inflammation, and make exercise more tolerable. We have 2 other phases, the late subacute acute care phase, and then the post-acute care. And this is post-acute is after 14 days. And after 14 days, ice really, there's no significant research that supports the use of ice after 14 days unless there's muscle spasming occurring or there's still swelling present. So then ice is still warranted to apply. And if you have tissue damage following a surgery because of swelling, you would continue to apply ice as well. But for chronic issues and overuse issues, there's not really a lot of evidence that's going to support applying ice unless muscle spasm and swelling are present. Now, when should you not use ice? If somebody has a hypersensitivity to cold, there's actually a disease called Raynaud's disease. If there's a hypersensitivity to cold, then cold application would be contraindicated and should not be used. You want to also avoid applying ice to an area that does not have good circulation. So for someone who doesn't have good sensation, doesn't have good blood flow, you would not apply ice to that area because they can't feel when it gets too cold or if it goes numb. And then they can get frostbite. If somebody has a cardiac disorder that is known, you also do not want to apply ice. And you also don't want to apply ice and then apply a compression wrap around it because it increases the risk of frostbite. For ice packs, you do not want to apply ice directly onto the skin because of the risk of frostbite as well. So those are times when you would not choose to use ice. A cold hypersensitivity, a known cardiac disorder. If you're applying a compression wrap, you don't put that on top of the ice pack, and you don't apply ice directly to the skin if you're using a commercial gel ice pack. And you don't put ice in an area that has compromised circulation or sensation. Now, how do you make your own homemade ice pack? You only need a few ingredients. You need a large, resealable or reusable sealable freezer bag. You need a small or the same size 1 gallon reusable sealable freezer bag, rubbing alcohol, and some tap water. I'm going to show you how to make an ice pack. And basically, I have my supplies already here. You're going to take the Ziploc bag or the resealable usable bag, and then you're going to, I've already measured out water, so you're going to pour the water in. And if you're careful, you can just let that sit there. And give it a little hold. And then you're going to measure out a 1-to-1 ratio of rubbing alcohol. So 1 cup to 1 cup. The rubbing alcohol actually prevents the water from freezing. Actually did spill a little bit of water, but it's just water. I'll add a little bit more water into the bag. It should be about 3/4 full. So I like to say it's a 1-to-1 ratio. If you want your bag a little more slushy, then you would add more water. If you want it more liquid, then you would add more rubbing alcohol. The rubbing alcohol prevents the ice from freezing, but it also gets really cold. So it's important not to, once this is frozen, not to apply this directly onto the skin. The reason you want to double bag it is just in case you get a puncture into the smaller bag, and you can use a larger bag within the gallon bag, that's fine. It's really up to you and to the size of the body part that you're trying to apply ice to. So then you would put that into the freezer. And I actually pre-made a bag in the freezer. You can always label this as well. My pre-made bag is labeled, but you can see it's pretty slushy, it's liquidy. Again, if you want to have it more slushy, you could try a 2-to-1 ratio, 2 cups of water to 1 cup of rubbing alcohol. Either way, this is super cold, so you wouldn't want to apply it directly to your skin. You'd want to put a towel between your skin and the ice. And this works great for wrists and ankles because it's very pliable, and those areas are often more difficult for ice cubes and ice cubes into a Ziploc or a resealable bag. It's harder for that to mold to those smaller areas, but you can make them bigger to accommodate a shoulder or a knee. You always want to make sure that there's at least 1 layer of towel between this ice pack and your skin, because even just resting on my hand here, that's really cold. The rubbing alcohol interacts with the water, makes that freezing point very, very cold. And then when you're finished, you've labeled it, and you can just put it back into the freezer to be used for the next time. So it's super easy, costs less than $3. It saves you a good $20 to $30 from a commercial ice pack, and they last a good 3 months. I've had success with about 2-3 months. The only thing that you need to do is sometimes the rubbing alcohol will start to evaporate, and then you want to be able to replace that, but you can just refill the bag with a little more water or rubbing alcohol, and then you have your homemade ice pack ready to go when you need it. I hope this helps anytime you need ice. Now you know when to use ice, what the benefits of ice are, and how to make and apply a reusable, sealable ice pack using rubbing alcohol and water. Have a great day today. Thank you so much.